Okay, this video is on non-communicable diseases. We've finished the communicable disease, the last one being pneumonia. And communicable diseases are non-communicable diseases are those which do not spread from person to person. And it is also referred to as a lifestyle disease. It's caused by a person's lifestyle. Causes are overuse of tobacco in the form of chewing tobacco, your cigarettes, overuse of alcohol, abuse of alcohol, sugar, too much sugar in the body, fats, and a poor diet, and an inactive lifestyle. So this all has to do with a person's lifestyle. The food that he prefers, things that he wants to eat, all of that, okay? So, common diseases that are caused by your lifestyle are your diabetes, hyperglycemia, okay? Blood pressure, high blood pressure, stone formation in your kidneys and your gallbladder, kidney failure, heart failure, blockage of arteries, osteoporosis, weak bones, and cancer. So all of these diseases do not spread from person to person, but they can be corrected by just correcting the lifestyle. Correction of lifestyle, food habits can, control all of these diseases. And inactive lifestyle, meaning if a person does not undergo physical exercise, which is very important. Physical exercises are really important. We talk about exercise helping circulate the blood. Actually, the blood is circulated by the heart. But when we talk about circulation, we often forget that there's something called lymph, which does not circulate just by the working pumping of the heart. And lymph, as you understand, can remove the toxic agents from the tissues. So the movement of lymph is enhanced by muscular movement, physical exercise. So when we do physical exercise, it actually squeezes those lymphatic vessels and forces the lymph to move forward and to remove the toxins and harmful chemicals from the different parts of the body. And this is the circulation that we're talking about when we talk about physical exercise. Of course, drinking enough water, getting enough sleep, and taking a balanced diet, all that comes under your comes under your lifestyle. Okay, it also has to do with taking too much sugar, fat, people who love pork, people who can't survive without alcohol, all of that can be cured. Now, the next disease that we're going to deal with is called cancer. What is cancer? It is uncontrolled and abnormal cell growth. Cells in a tissue begin to multiply randomly and form a tumor. The formation of tumor inside the body, the organs of the body, that will cause problems. And it also has the potential to invade nearby tissues, other tissues also. There are basically two types of cancer. One is called the benign, which grows and multiplies on a spot only, so it does not spread. It does not spread. And the other one is malignant, which has a tendency to invade other tissues and multiply. So this is going to be deadly. So there are many different ways of treating cancer. And cancer can be caused by a lot of things, chemicals that we take in, especially alcohol and tobacco, can cause different types of cancer. And then we also have radiation. This is something that we are not giving enough attention to. Radiation can come from, not just the deadly rays from the sun. It can come from the mobile towers, the electricity, all of that. And your what do you call nuclear wastes, radiation. All of that can have an effect on generating cancer or cancerous cells. Treatment of cancer. First of all, it needs to be diagnosed very early. So if it's diagnosed very early, surgery would be the best method. Just slicing it off from the body. And of course, if it has invaded different tissues, then slicing off big chunks of the body would not be possible. So you'll have to go through chemotherapy, using some drugs, and then radiation. So radiation of some rays that can kill these cells. But recently, the most promising treatment is what's called the CAR T cell, or chimeric antigen receptor T cell treatment. Okay, simply said, CAR T cell treatment. Now, T cells are a type of white blood cells which has a very important role to play in immunity, the way immunity works. Now, for this, the working of immunity, I'm going to do another video, is important, okay? Where we'll be dealing a lot with T cells and B cells. Now, just understand that this treatment is a method of modifying a T cell by adding a couple of genes in it. It's a gene treatment here. So it modifies the what we call T cells so that the T cells are able to recognize and destroy cancer cells more efficiently. So what we are looking to the future is CAR T cell treatment for cancer. Okay, and so this is all about non-communicable disease. The third type of disease is known as genetic disorders. Genetic disorders are inherited at birth. Colorblind, some common ones you already know. Colorblindness, hemophilia, and sickle cell anemia, a lack of RBC, proper RBC. Then you have thalassemia, which is again related to RBC, where you have less amount of hemoglobin. Hemoglobin not sufficient enough to carry oxygen. So that means the body will not get enough oxygen. It's almost like anemia, where the supply of oxygen to different parts of the body is hampered. Let me go down to Down syndrome, which has to do with trisomy 21, which just means on the 21st pair of chromosomes, there should be 2 chromosomes, but there are 3. The 23rd pair should have 2 chromosomes, but this disorder has 3 chromosomes, and it's called trisomy 21. And this, in its early stage, when the baby is born with trisomy 21, its development, mental development, and its development of other parts of the body is hampered. So, a mentally retarded person is a result of it. So, But this can be, if it's detected early, now we have, early detecting devices or procedures which can detect what's called Down syndrome, and it can be treated by gene therapy. We're talking about gene therapy and modifying a T cell. All of this comes under your biotechnology, which some of you are really interested in it. For this again, I'm going to do another video, okay, biotechnology. But treating, your genetic disease by modifying the genes is biotechnology. That is how it's treated. And the new methods of treatment of different diseases, biotechnology has a lot of role to play in the future. So we are looking forward to biotechnology and the stem cells and the study on it to eradicate all of the diseases that are known to humankind till date. Right?